Hello, and welcome to Patch It Up, LifeWave Patching Podcast. With your host, Nicole Noles Collins, acupuncture physician at Vitality Acupuncture, and Dr. Sean Dumas. Say hello,
Hi.
Dr.
Hi, how are you?
Before we get started about today's LifeWave presentation, I'd like to just mention that the statements that we make today on LifeWave products, websites, or associated materials have not been evaluated by any regulatory authority and are not intended to diagnose, treat, cure, or prevent any disease or medical condition. The content provided by LifeWave is presented in summary form, is general in nature, and is provided for informational purposes only. Do not disregard any medical advice you have received or delay in seeking it because of something you've read on our websites or associated materials. Please consult your own physician or appropriate healthcare provider about the applicability of any opinions or recommendations with respect to your own symptoms or medical conditions, as these diseases commonly present with variable signs and symptoms. Always consult with your physician or other qualified healthcare provider before embarking on a new treatment, diet, or fitness program. We assume no liability or responsibility for damage or injury to persons or property arising from any use of any product, information, idea, or instruction contained in the materials provided to you. LifeWave reserves the right to change or discontinue at any time any aspect or feature containing our information. So let's get started. What can
Okay.
LifeWave patches do for you? LifeWave is an advanced technology company. We seek to improve the health, wellness, beauty, and longevity of every person we encounter, with no drugs, pills, opioids, or injections. Our patented wearable technology harnesses the power of acupressure therapy to boost health at the cellular level. Product distribution of our LifeWave patches began in 2004. We have warehouses now in 12 countries with worldwide distribution. We have messaging as many as 9 languages. And some of the questions you might want to ask yourself today. With your health and how you look and feel, are you satisfied? Are you satisfied where you are with your finances? And are you satisfied with how your future is unfolding? If you answer no to any of those, you're not alone. And if you know others who would answer the same way, you're in the right place at the right time with the right opportunity. LifeWave is expanding with products that people need. It's a wearable technology in patch form, which is affordable, safe, non-invasive, and non-drug. It's a patented form of acupressure therapy, and each patch uses light to increase or improve specific naturally occurring cellular action in your body. Our unique products are exclusively protected by multiple patents with over 80 research and clinical studies done by independent researchers and universities, by medical and scientific experts. All of our patches are available in occasional use or 30-day supply sleeves. There is a vast market for our products. They may help with increased energy and endurance, safe and natural pain relief, enhanced quality of sleep, reduced stress, immune system support, appetite control, may help you look younger, feel stronger, and perform better and heal faster. With no drugs, chemicals, stimulants, or side effects. Our patch technology is incredibly effective for many people. Here are some of the testimonials from real people using the patches. The healing is remarkable. I believe I won't even have a scar. For the first time in a year, my knee is not hurting. Your tech has given me my life back. No pain, more energy, better sleep, improved vision, greater clarity. My husband says I look a lot younger. So here is a slide presentation of real people getting real results from the LifeWave patches. And these are all user submitted photos. So you can see a broad variety of conditions people are using the patches for. And we all have our own personal stories about how the patches have helped us. Dr. Dumas, do you want to share your story?
Sure. So I guess about 4 months ago, I was in the hospital because I had fallen 7 times. Come to find out, they diagnosed me with Parkinsonism. So what that means is I had shaking and all that kind of stuff. I had numbness. I couldn't walk. I stumbled a lot. And I was put on a medication. So, and let me tell you now, real quick, um, we are not allowed to talk about medications. We cannot say what you can take and can't take. What you need to do is go to your doctor, your prescribing MD, and figure out with him or her. Okay. But I did with my doctor get off of the medication, believe it or not, because I started the patches. The medication really wasn't working for me personally. So I needed something extra. And I was thinking about stem cells. And then I thought, oh, well, Dr. Knowles has given me these patches that I have yet to use, and they're for helping you get better with stem cells. So what I did is started patching, and I now am off of my meds completely, thanks to my MD, and the patches. I am also, let's see, I have no more numbness. I'm not falling. I can walk again. I'm not shaking anymore. My brain still hasn't come back yet. So if I forget something, that's why. Don't. But other than that, I'm doing great. Because I've been off of the meds now for about 7 days. Um, I just want to make sure that I keep on the patches so that I don't have any kind of DTs from coming off my meds. So I'm very excited about this.
That's an amazing story.
Yeah.
One of the ways that patches have helped me, several years ago, I had a really bad sprain right before I was going to see acupuncture patients for the day. And I'd fallen out of one of the doors for one of the other units. So I limped back to my office. I put on the X39 and I put the ice wave patches on my ankle. And I did not stay off my ankle. I still saw my full schedule of patients that day. And I patched myself 24 hours a day. So the patches last 12 hours at a time. So every 12 hours, I would change out the patches. And a usual sprain takes about 8 weeks to heal. But because I used the patches, I was able to heal my ankle in 3 weeks. I never stopped working. I never um, used a wheelchair or any sort of an aid to get around or a scooter. I just continued to walk on my ankle, do everything I normally did at the normal pace, and I was still able to heal my ankle within 3 weeks instead of 8 with no lingering pain in that ankle. Now, the
Yeah.
other ankle that I had injured several years before that, it was before I started using the patches, and I continue to have residual pain on that ankle to this day. But the
Mhm.
one that I use the LifeWave patches on has been great ever since.
And the ice wave, that's for pain specifically, correct?
I use it for acute pain when I
Yep.
have an injury. Now, my husband a couple of weeks ago had a really large knot in his back, right underneath his scapula or his shoulder. So he put the ice wave patches right on that knot, and he said within about an hour, he felt it just melt away, and it hasn't come back since.
Awesome. That's amazing. Yay.
Now, one of the things that I've been using recently, my trans daughter recently died by suicide, and it's just really shaken the whole family up, of
Mhm.
course. And one of the patches that I'm really relying on to help me get through this situation is the Eon patches. AEON. So that one can help calm your mind, calm your emotion. So I've been using that one on PC6 to help me get through the day. And so that I can do all the things that I need to do to plan her funeral and work on her estate. And it doesn't take the sadness away, it doesn't take the grief away, but it kind of helps calm it down enough to where I can be functional throughout the day and not crying all day long.
That's
And that's a
amazing.
huge help.
Yes, I bet it is. My gosh. Yeah. Just so you know, I've been doing the AEON as well, eons, on Anion for my nervousness. So yeah,
And what
that's
have
what I
you
found.
noticed about that?
What I found was when I went off the dopamine, the L-dopa, levodopa, my anxiety came back, and that's a huge deal for me. So I put it on, and I've been pretty good today. It's not been bad today. So yay.
The Eon patches are quickly becoming one of my favorites.
Yeah, I bet.
So here's just a close-up of two of the pictures that were on the previous slide. And just showing, if you look to the picture on the right, it's a picture in 2018 and a picture in 2020 of the same area of the cervical spine, and you can see the difference in the spine. Now, keep in mind that when you use the patches, a lot of people want a quick fix. They want something that's going to help right away and just be done. But one of the benefits of the patches and using the patches consistently over several months or years is that it gives your body an opportunity to repair itself more efficiently. So the LifeWave technology, you can get benefits from just using it occasionally if you need it, but you're going to get a more sustained improvement if you're consistent with your plan of care.
Yep. And a good rule of thumb is for your age, you want to have the patches on for a month, for every 10 years you're aged of your age. So I'm 62, so I need to keep mine on for 6 months. I'll probably keep mine on forever. The X39s forever, I think. But that's a good rule of thumb for you.
That's an excellent point. So you may or may not have seen this out in the media, but many pro and amateur athletes use the LifeWave technology in order to increase their athletic performance. As you know, athletes who take their performance seriously, even getting a 1 or 5% improvement in performance can often give them the edge to compete. So the LifeWave technology has helped several different athletes across several different sports improve their athletic performance. Welcome to the stem cell revolution. So, what are these patches? These patches activate your stem cells, and you have the opportunity to help people improve their health using stem cells in a way that's very affordable and easy to use. It doesn't take a prescription. It's not hard to get a hold of. It's something that you can use in order to make your body function more efficiently. But how does that work? So what we're using is the GHK pathway in the body. The GHK pathways can help your stem cells to start producing again. And when you start producing more stem cells, you revert or reset to a younger, healthier state. The GH copper peptides activates your own stem cells to repair and regenerate you, just like when you were younger. As we age, we produce less and less stem cells, slowing down our body's ability to repair and regenerate itself. The GHK copper peptide activates pluripotent stem cells, which have the unique ability to turn into any cell the body needs for repair and regeneration of critical issues, such as our skin, connective tissues, and organs. And that's the reason why these patches can help so many people, even though everyone has individual and different things that they need help repairing. What can increased GHK production do for you? It can help with your skin and hair. It can help with lung protection. It can help with antioxidant and anti-inflammatory processes. And it can help manage cells and cell growth. It can help with your brain and nerves. and it can increase the healing of many tissues, including skin, stomach, intestine lining, and bone tissue. It strongly chemo-attracted capillary cells, mast cells, and macrophages. It strongly activates genes of the ubiquitin proteasome system used for cell cleansing, block cortisone's anti-regeneration effects, suppressing the insulin and insulin-like system that reduces lifespan in roundworms, reduced fibrogen synthesis, and increased myostatin.
Can I jump in for just a second?
Yes,
So what I've noticed, yes, I was working on my brain, for my Parkinson's diagnosis, but what I've noticed too is my neck is no longer sore because I always put it on Do 14, the X39s on Do 14. My neck is no longer sore, and I have bone spurs and all kinds of stuff. I'm really looking forward to getting another X-ray and seeing what it looks like. But also, I think my eyesight is getting better because,
that's
as you know,
amazing.
I have to wear these cheaters all the time, and now I'm noticing, oh, yeah, do I have to hold it out this far? Yes, but I can actually see it now. I'm like, oh my gosh, this is so cool.
So that brings up a good point. What are some of the acupuncture points that you're putting the patches on?
All right, so one of the things when you get your packet, you're going to see a picture, and it's two pictures. One is at the back of the neck, one is at the belly button, right below the belly button. So the one at the back of the neck is called Do 14, DU, and the number 14. And the Do is a channel that runs from the bottom of your spine all the way up into the neck, and it goes into the brain and then comes around and comes out right here um, at yin tongue. So that's really nice for brain stuff and things like that. Do 14 can be used for what we call exterior invasions. That means if you catch a cold or anything like that, you can slap one on, things like that. The one on the belly is called Ren 6. Ren is another REN 6. This is another great point. It's for energy. It's the point for energy. Either that, or you can actually add it to Ren 17, which is between the breasts. To find the Ren 17, you want to feel your clavicle. If you drop down, you'll be into your intercostal, which is the in between your rib cage. Go 1, 2, 3, and 4. Come across onto your sternum, and that's Ren 17. Ren 17 is considered the sea of chi. Chi is your energy. So that's a great one if you want to, if you're really tired, maybe you want to put it on Ren 17 instead of do 14, So there's all kinds of different ways you can do that. One of the things that you talked about for AEON, I never know how to say it, is PC6. So PC6 is in between the tendons here. If you take your knuckle right here at the crease and you roll down, that's PC6, and that's where you want to place um, any of them. So PC6 is great for heart stuff, and meaning not only physical heart stuff, but emotional heart stuff. So, because PC means pericardium, and pericardium is the protector of the heart. So you always want to have your protected heart, right? Yay. Hmm.
All right, so for the Eon, PC6,
What
um,
else?
did you talk about Omnion?
Oh, on. Oh yeah, on. So that means sleep, good sleep, on. And what that does is I actually had mine on PC6 and it really wasn't helping much. So I changed it up to Onmion and that helped a greater deal. So you can play around with these and see where you want to put them, which one works better for you. Onmion, if you take your finger right here and then come back and you feel that little indent right there, it's right smack in the middle. If you want an easier way to find that, just find the little bone that's behind the ear and place it right underneath of it. And with stem cells or the production of the igniting of your stem cells, you don't really need to be on the point specifically as long as you're near it. because it's biomodulating. So it'll work either way. So yeah. Yay.
So some people use the sleep patch or the Eon.
Oh
You can
yeah.
also do it on yin tongue as well, right between
Yep.
the eyebrows.
Yep. Yin Tongue is amazing. Yin Tongue is very calming. It's you want to use it when you're upset or anxious or anything like that. Maybe I should put it on there right now.
Well, let's talk
Oh.
about some of the other patches that we have. The spleen 6 that many people use when they're trying to work on their ideal weight and snacking issues. It's called SP6. And oftentimes people will put that either on stomach 36 or spleen 6, which are both on the legs.
Hmm. Yep. And the way you find those is you have to take your hand, and this is considered 3 sun from here to here. Okay. 3 sun. So it's just a Chinese measurement. It's their inches. Their inches. Okay. What you want to do is take that and place it right below your kneecap. If you do that, then you're 3 sun below the kneecap, and that's where stomach 36 is. Stomach 36 is a huge point for energy, weight loss. You want to use it for any kind of digestive issues, things like that. You're going to do the same thing down at the inside of your ankle bone, your malleolus, your medial malleolus. Place it right on the bone. And if you come up the leg, you're going to find that that's where spleen 6 is. Spleen 6 is specifically for digestive issues. Your spleen is meant to digest your food and get the energy from it and make blood and make chi and make all the things that you need. So it's a great point.
And then some of the other patches we have, like the carnosine, those are great on the liver channel. For instance,
Mm.
liver 3 or liver 14.
Liver 3 is all right. So if you take your finger and you place it at the web of your toe, your big toe and your second toe, and then just come up to where you hit the bone, that's liver 3. You want to explain liver 14 for me?
I was hoping you would.
Liver 14 is at the end of your last rib, and it's a floating rib, which means it doesn't attach to anything. So if you feel on the side of your body, and you feel where that one rib is, and it's probably tender. Yeah, it's tender on me. Yeah, that's liver 14. That's great for weight loss as well, for detoxing. The liver, as we know in Western medicine, is all about detoxing. If you have a sluggish liver, you're really not going to lose weight very well. So you want to get that nice and clean.
Does anybody have any questions?
Judy, Judy's here. Yay, my sister's here. So Judy, if you don't mind me asking, she just recently got her patches and she just recently put it, I think she's doing do 14. Yes?
Yes,
Yay. And is this your second day?
I think.
Yeah, I think it is too. Any changes, any feelings, anything going on yet?
Not really. And that was interesting. I was looking at your graphics. Should
Mhm.
I have the pain ones on at the same time I have that on? Because
Yes,
as it turned out, I'm like on opposite 12-hour shifts. So it's like, should I have them all on at the same time?
yes. I would say yes.
Okay. So,
Dr. Nicole?
So that's what I did when I was working on healing my ankle sprain on my right ankle. I used the X39 and I used the ice wave patches, and I put them in a triangle configuration on the outside of my ankle. So I wore all three patches and I just switched them out every 12 hours for 3 weeks straight. So you can definitely use more than one patch at a time.
Yeah. I've got 3 on right now. I've got my X39s on do 14. I have carnosine on Ren 6. Yep, I put on Ren 6. And then I've got my Eon on my on me on. So I've got three of them on today.
And I almost forgot one of my favorite sets of patches are the energy enhancers. That's the two patch system.
Mm,
And a lot of times I will have people put the energy enhancers on lung one and lung two. Or if they're having leg issues, I'll have them put them on GB 31 or stomach 36.
mm. So lung 1 is and lung 2 are right at the clavicle. And if you can find where your clavicle indents, okay, goes up slightly, that's where Ren 2 is. Ren 1 is just one sun, which is the thumb
Lung one.
below it. Lung 1, sorry. So you can either press it or you can put your patches on there. Judy, I would think that you might benefit with Do 4 instead of Do 14. Um, Dr. Nicole, can you go back to that one slide for me where it showed her with the patches on? I think she's got hers on Do 4. Yes. Yep, there she goes. So yeah, so this one is, believe it or not, right here. I don't know if you can tell where so if you look, can you go to the next slide for me, baby? Thank you. So if you look here,
Is below.
see where her brown patch is
Yes.
on the spine?
Uh-huh.
That's Do 4. So if you wanted to go anywhere on the spine, above, where your hips are, your hip bones,
Uh-huh.
I would put it there and see if that makes a difference. And then
That's
you can go,
that's the pain one, right?
no, that's X39s.
But
I
they're
would
not,
put
mine aren't brown, the X39.
correct. So she's probably got hers up here. But what I would do is, where's your pain the most?
Um, I mean, lately it's been on the right knee and the left butt cheek.
All right, so I would do X39s on Do 4.
So that's the one below that's like the white one, the highest white
Mhm.
one, not on her back.
It would be, can you place your pointer for me, baby, Nicole? Thank you.
Yeah.
There.
Okay, so
See where her pointer is?
that's the X39 should go there.
Yep,
How come mine's
I
not
would.
brown?
That's okay. Don't worry
Because
about it.
she's wearing a different patch, she's
Oh,
probably wearing the ice wave or the energy enhancers.
So
well,
you notice she's got
you had
hers at,
a white,
yeah.
but I should
And
be
then
wearing.
I would put the brown on your butt cheek.
Okay, I did that last night and I could feel the difference.
Oh, yay! Good.
The first
Awesome.
night I didn't put it, I put it lower on my lower down because that's where it was burning. But
Mm-hmm.
it's weird. I could feel like the sensation, but it was still painful. So last night I put it on my butt and I could feel the difference. I could feel it numbing it or whatever.
Oh, nice.
So, but I've been, like I said, I haven't been wearing them all at the same time.
Mm-hmm.
Like I've been taking because I've got the one on, the X39. I've been wearing that during the day and I didn't think to put the other one on until night. So I've been on opposite 12-hour shifts. So I should,
That's, you could do that too, can't you,
Yeah.
Dr. Nicole? Yeah. Yeah, I think that's great.
okay.
And if it's,
I didn't know if you had to wear them all at one time.
no, you do not, but you can, but you don't have to.
Okay.
And you can
Yeah.
switch them out every 12 hours. Just
Right.
keep in mind the ice wave is two patch
Right.
set. So there's a white one and a brown one, and those need to be somewhat near each other if you're going to use them.
Okay. Because I have one on my butt and one just above, like where that one is on this picture on the left hand
Oh,
side.
Okay.
perfect. Perfect.
No, not
Yay.
the other one.
Oh, the other one.
Because I've had them both on the same side. You said don't cross the spine.
Correct. Yep. Good. Yay.
So this one on the opposite side from the pointers where I put the second one last night.
Awesome.
And I could feel
Yeah.
the difference.
Oh, great. Yay.
I'm thinking about switching to my knee tonight because that's been acting up.
Oh, yeah, absolutely. Do it.
So
And
Hmm.
that brings up a good point. No matter where you put the patches, they will work locally, but they will also work globally. So don't feel like if you put them on one body part, the rest of your body is going to suffer. It's not. Your body's innate wisdom will determine what it's going to heal and repair first.
Yeah. Awesome. Thank you, Judy.
Another thing to keep in mind is when you're wearing the patches, it's really important to stay well hydrated and to not fast so that you can give your body the nutrients it needs to do the repair work.
Mhm. And you always need water, 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 water.
yeah, always.
Mm-hmm. Yep.
I'm usually always thirsty anyway, so
Oh,
that
well,
works.
yep, exactly. Good.
Is
All
there
right.
anything else you wanted to add, Dr. Dumas?
I don't think so. I think we're good.
We've hit most of the patches.
Mm-hmm. Let me think. What are your thoughts on the X49?
So I don't wear those every day, but during the workday where I had kind of chest tightness, I would put the X49 on Ren 17, and I would notice a difference in as little as 10 minutes. It felt like it was laterally opening up my chest.
Awesome. Cool. Thank you.
When do I get the liver detox one?
You want the liver detox one, honey? I'll get it for you.
Eventually, it wouldn't
Yep, I
hurt.
I got that. I got you covered.
All right, I'm going to go ahead and stop the recording now.